afternoon. Good afternoon. Good afternoon. I want to thank Jennifer for extending an opportunity for me to come and just share some of the ideas and thoughts around children's issues and leadership needed and required in what everybody's calling post-Katrina environment. My name is Mary Joseph, and I'm currently the Executive Director of the Children's Defense Fund office here in Louisiana, newly created office in Louisiana. I think we've been up and running now a year. And we really were born out of crisis, but as an organization, Children's Defense Fund has been around for about 30 plus years and was founded by Marion Wright Edelman, who has a passion, and I would just say just tremendous energy, just never letting up, trying to be a voice for children in America. Who am I? I did not send a bio because when I talk about children, I first want to say I'm a mom and a grandma, but my work history has been in social services. I recently left state government where I was the Deputy Assistant Secretary for the Department of Social Services Office of Family Support. We were responsible for food stamps and all of your TANF benefits, child support, all of those child supportive type needs or issues came across my desk, and I did that for 30 plus years of work, starting out here in New Orleans and being a part of the social service fabric here, just on the ground and watching a lot of things just come and go. But what I want to share with you today is where we are with the Children's Defense Fund in terms of what we're now calling a call to conscience and action. And it fits perfectly in with this whole theme about leadership and what's important and where we should be going now in our nation. And it's not just here in Louisiana. We have moved from, in the Children's Defense Fund, from talking about children in sort of income segregated ways to begin to talk about all children. Katrina is a good example of what can happen to children. It's a day when a lot of folks had fortune and fame, and with the wind and some water, everybody, regardless of where you came from, was standing in the Red Cross line. All kinds of folks were standing in the Red Cross line. When I evacuated and got to Atlanta, first thing somebody said, well, have you been to Red Cross? I'm like, what? Did you go get your food stamps from there? I said, what? You know, it's like, oh, wait a minute. I'm in a line. And let me tell you, my girlfriend called me. I said, girl, I don't need none of that. I got a little dollar. I got a little State Farm money. I'm at my son's house. I'm chilling. I'm cool. It's fine. Everything's okay. And she's a clinical social worker. She says, get your butt up. Get in a line so you can feel what the people are feeling. Because you can't talk and support people if you don't feel what they're feeling. So, y'all, I get up, drag my husband. He won't go. I said, come on, we got to go to the line. We got to go down there with the line with the people. So he gets down there. I don't want to stand in this line. What am I in this line for? I said, you lost all your stuff in New Orleans. You don't have anything to go back to. Well, but that's okay. I think I can make it. I said, you better get in this line, and let's see what we can, you know, how can we pull ourselves back together? It was the best thing that I could have done, because it helped me to understand, too, and feel what people were feeling going through these lines and standing in the heat for hours waiting on a $200 check from the Red Cross. And it gave witness to what children endure standing in those lines with their parents in the heat waiting for these $200 handouts. But it's a wonderful opportunity for us, all of you who I'm sure love children, and that's why you're here. They tell me this is the maternal and child health group, and You're all looking at leadership issues around children. Well, the children from Katrina, which is what our report is all about, and the reason why I chose not to send cryptic notes, etc., because in that report are real children that I had the opportunity of visiting with, helping to select, to tell their stories about what they experienced when they left New Orleans and what they're experiencing in this diaspora of being scattered all over this nation like birdseed. So for public health professionals like you, there's going to be a lot of work. It's a lot of work before Katrina. It's a lot of work needed after Katrina. I've come not so much to spout data and statistics, because when I needed data and statistics in my work, I'd call over here. Y'all know that, huh? Y'all have it. So you know what's happening to children in our state. You know what's happening to children in our nation. But what my boss, Marion Wright Edelman, says is we need a call to conscience around why we are letting certain things happen to children in our nation, and why we as leaders have become apathetic around it. I stand here somewhat ashamed of my career. Somewhat ashamed, because as a leader I was in an apathetic position of accepting poor policies that right now stare us back in the face to say, look what you have done to children. Look what you have done to children. Look what we have done to children. And so today, before I get into some other pieces on my presentation, I'd like for you to just watch this very short video. It's called What About the Children? We're about to launch at the Children's Defense Fund a national campaign across this nation, every state, but I want you to know that Louisiana is a key state where we're going to try to see if we can get the policymakers to decide which is going to be their God. Is it going to be war? Or is it going to be an investment in human capital to our children? And support national legislation that will provide health care for all children. We're not talking about income-based health care. We're not talking about you get some benefits over in Texas that you don't get here. We're not talking about you get medical protocols in Massachusetts that you don't get in Mississippi. We're talking about health care for all children where the playing field is leveled. Because we have got to get out of these rocky, unlevel playing fields that we have put children on. So I just want to set your spirit around why this work is so valuable.